Do you know what peptic ulcer disease is and how it affects your body? Peptic ulcer disease, or PUD, refers to open sores that form on the inner lining of your stomach or the upper part of your small intestine, known as the duodenum. These sores, or ulcers, develop when the protective lining of these areas is eroded, allowing the stomach acid to irritate the underlying tissues. Now there are two types: gastric ulcers that form in the stomach and duodenal ulcers that occur in the upper part of the small intestine. Each of these has similar causes but can present with slightly different symptoms and complications. The primary culprits behind the formation of these ulcers include a bacterium known as Helicobacter pylori and the use of nonsteroidal anti-inflammatory drugs like aspirin and ibuprofen. Understanding peptic ulcer disease can help you recognize its symptoms and seek timely medical intervention. What causes peptic ulcer disease and who is more at risk? Peptic ulcer disease, or PUD, primarily arises due to two main factors: infection with a bacterium known as Helicobacter pylori and the use of nonsteroidal anti-inflammatory drugs, commonly referred to as NSAIDs. These include medications such as aspirin and ibuprofen, but these aren't the only culprits. Other risk factors play a significant role too. Regular smoking and excessive alcohol consumption can increase the likelihood of developing ulcers. Additionally, if you have a family history of ulcers, you may be more predisposed to this condition. It's also worth noting that peptic ulcers are more common in older adults and males. While stress doesn't directly cause ulcers, it can certainly make the symptoms worse. So managing stress effectively is crucial too. Knowing the causes and risk factors can help you manage your risk and prevent the development of peptic ulcers. Remember, understanding is the first step towards prevention and management. How would you know if you have peptic ulcer disease? The signs and symptoms of this condition can vary, but there are a few key indicators to watch out for. One of the most common symptoms is a burning stomach pain. This typically manifests in the upper abdomen and can range from mild to severe. It might flare up when your stomach is empty and ease off after eating or taking an antacid. Another significant symptom is heartburn. This is a burning sensation in your chest, often accompanied by a sour taste in your mouth. It's not uncommon for people with peptic ulcer disease to also experience nausea and vomiting, particularly if the ulcer is located in the stomach. Bloating or feeling full after eating even a small meal, and a noticeable loss of appetite, are other symptoms that might hint towards peptic ulcer disease. Recognizing these symptoms is the first step towards getting a proper diagnosis and treatment. How is peptic ulcer disease treated and managed? You may wonder. Well, it involves a multifaceted approach that includes medications, antibiotics, and lifestyle changes. Firstly, medications play a pivotal role. Antacids neutralize stomach acid, providing quick relief from pain and discomfort. Proton pump inhibitors, or PPIs, and H2 blockers reduce acid production, creating a more conducive environment for healing. If the culprit behind the ulcer is the Helicobacter pylori infection, antibiotics come into play. A common strategy is the use of triple therapy, which includes a PPI and 2 antibiotics, usually amoxicillin or clarithromycin, and another one such as metronidazole or tetracycline. This trio works together to eliminate the bacteria and reduce stomach acid. But treatment isn't just about pills and potions. Lifestyle modifications are crucial too. This can mean avoiding NSAIDs, managing stress better, quitting smoking, and moderating alcohol intake. It's about making choices that protect the stomach lining and promote healing. Dietary changes can also be beneficial. Eating smaller, more frequent meals and avoiding spicy or acidic foods can ease symptoms. Incorporating a diet rich in fruits, vegetables, lean proteins, whole grains, low-fat dairy and probiotics can help maintain a healthy gut flora. In severe cases or when complications arise, surgery may be necessary, but this is usually a last resort. Remember, early intervention is key. Effective treatment and management can help heal ulcers and prevent complications. So if you're experiencing symptoms, do seek medical help. So, what have we learned about peptic ulcer disease? It's an issue that arises when the protective lining of the stomach or duodenum is eroded, leading to painful ulcers. The primary culprits, H. pylori infection and NSAIDs. Symptoms range from burning stomach pain to nausea. However, solutions are available, from medications and antibiotics to lifestyle modifications. Remember, early intervention is crucial in managing peptic ulcer disease. If you're experiencing any of these symptoms, seek medical attention promptly.